Hi, I'm Dr. Doug Cowan, and welcome to the ADHD Information Library. Let's take a few minutes to talk about classic ADHD. It's classic because it's the most common. It's what you think of when you think about ADHD. We call it impulsive hyperactive type of ADHD, and around here we call it Tigger type because Tigger is the best way to illustrate it. Tigger from the Winnie the Pooh stories. Best way to illustrate this kind of ADHD because it's bouncy and Tiggers like to bounce. That's what Tiggers do best. So what are these children with impulsive hyperactive type of ADHD? What do they look like? Well, they're easily distracted by things. They have short attention spans. They have this problem of inattention. But they also are impulsive. They will do things without stopping and thinking first. And you're always asking them, why did you do that? And they don't know. They just do kind of the first thing that comes to mind. They can also be hyperactive. Hyperactivity has been defined as excessive, non-goal-directed motor activity. And a really good description of that is that they act as if they've been driven by a motor. So they're like Tigger. They're just moving and bouncing a lot. They can be very restless, both in the daytime and even at nighttime. Happy hands, happy feet at the dinner table, trouble sitting down, getting the meal done, all those kinds of things are often seen. The body just needs to move. And they can also be easily bored. Unless they're doing something that they really like watching TV or playing a video game, they can be very, very, very restless, as if they have to keep moving in order to keep from falling asleep. They can be disorganized. They have a lot of energy, can't sit still very long, very fidgety. They can talk a lot and they can be very loud, and they can have trouble waiting their turn in line. That's also very common, or waiting their turn when they're playing games. Now, this type of ADHD is seen most often in boys. And when you look at this sort of spectrum here, the crossover between behavior disorders and attention disorders, where the inattentive type of ADHD is over on the learning disorder side of the spectrum, this type of ADHD is over on the behavior disorder side of the spectrum. There's a lot of things that these kids will do, actually, that will kind of get themselves in trouble, which is typically how they get diagnosed and often how they get help. Now, the problem with the brain here, what causes this is that the front part of the brain is under-aroused. Most people will think that their brain is overactive or hyperactive, but really the front part of the brain is the part that helps us to pay attention and sort of plans things and has a lot to do with self-control, with what we call inhibition. And this part of the brain is under-aroused. It's just not doing its job, even when it's at rest. And then when you give it workload, like a math worksheet or something like that to do, you'd expect that the part of the brain would rev up like the engine of a car, but it doesn't. It even slows down more, like it's about to stall, like it's about to fall asleep. Now, the biggest challenge that we see with these kids is the classroom setting. There are a lot of distractions in the classroom setting, everything from the other 30 kids in the classroom to the buzz of the lights overhead, the kids playing outside that you can see through the windows. The teacher is trying to talk, and it's just hard for these kids to focus on that teacher who's giving a lecture and asking to take notes and learn what she's saying. Very difficult place for these kids to be. Also, what we see is as the kids get older, and that's 5th grade, 6th grade, certainly junior high school years, where social problems are a challenge for any young teenager or even pre-adolescent, because junior high kids can be very cruel. Well, kids that are impulsive and maybe don't pick up on the subtle social kinds of cues, like these ADHD kids, they can have some real severe social problems. And so parents want you to be sensitive to that in your child if this is the problem as well. The most common treatment is stimulant medications. Now, why in the world would that be, since these are hyper kids? Well, it's because the stimulant medications work to perk up that front part of the brain. They increase blood flow. They produce certain neurotransmitters that are perhaps deficient, lacking in the front part of the brain. They help to optimize brain performance so that your child can focus attention and have increased self-control. That's how they work. Now, if your child goes to counseling, sees a therapist or a psychologist, which they should if they're taking medications, they really should, Your therapist, his job is to teach skills, not just to get insight, not to ask your child, well, how does that make you feel? I mean, that's appropriate once in a while. But the main thing is to teach the skills your child needs in order to be successful. So how do you increase your focus and attention span? How do you solve problems? These kids are described as being cognitively impulsive as well. When they solve problems, they simply do the first thing that comes to mind. There's a lot of trial and error involved for these kids. And so they need to learn problem-solving strategies. They need to learn how to get organized, not just how to get their